What's cervical instability? Cervical instability refers to excessive movement of the neck, two or more vertebrae at the cervical spine. It can lead to pain, neurologic symptoms like numbness, tingling, or weakness. What are some causes of cervical instability? Trauma, a whiplash injury, or fracture in the neck, or dislocation of one bone from another from an accident. Degenerative changes like arthritis can weaken the structures that support the spine that can result in instability. Congenital disorders, some people are predisposed to instability compared to others, especially patients with Ehlers-Danlos syndrome. Inflammatory disorders like rheumatoid arthritis can predispose a person to have cervical instability. Having had prior surgery, like a prior fusion surgery, can increase the risk of instability at the level above or below the fusion. How does it present? Patients often complain of neck pain. If it's a high cervical lesion, then it can also present in occipital area pain or pain in the back of the neck. And because it can cause compression of the spinal cord and the nerve, it can present with numbness, tingling, weakness, having balance difficulty, muscle spasm. How do you treat it? Start with conservative treatment, with over-the-counter medicine, physical therapy, temporary use of cervical collar, and if you had to do any intervention, you can do some interventional injection. But if it's gross instability, the only treatment in gross instability would be surgical treatment, and surgical treatment would be cervical fusion, not replacement. Replacement is actually contraindicated in the setting of cervical instability. And obviously, if you suspect that it's a minor instability, you can certainly watch it by getting frequent flexion extension x-rays of the neck to see if the degree of instability has not worsened or is stable. And you can share that with the patient, and then between the surgeon and the patient, you can come up with the plan that is most appropriate. Again, if it's gross instability, last resort would be surgery, but that's the only treatment that would be effective if strengthening exercises fail. But if it's a minor instability, certainly I would definitely watch that over time and communicate with the patient. If there are any worsening signs or symptoms, then you can consider surgical treatment at that point.